Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked. Over 50, the evidence-based routine for strength balance and heart health. A comprehensive guide to nutrition and exercise for adults. Aged 50 and above, enhancing strength, balance, and general health. Aging is an inevitable process that occurs universally, characterized by gradual physiological changes that influence an individual's strength, vitality, and overall health. Individuals over the age of 50 often undergo alterations such as diminished muscular strength, increased fatigue after physical activity, and changes in their sleep patterns. Such changes are commonplace and occur in many individuals. Nevertheless, a substantial body of scientific and clinical evidence indicates that proactive lifestyle interventions, particularly a consistent exercise regimen combined with carefully structured nutrition, can markedly reduce these age-related changes. These treatments assist individuals in maintaining independence and preserving physical function, strength, and endurance far into advanced age when used judiciously. Many individuals in this age group already engage in regular physical activity, such as walking in their neighborhood, doing simple stretching exercises, or employing low resistance in their home workouts. All forms of exercise are beneficial. Nevertheless, individuals often overlook the need of post-workout nutrition. The physiological principle of adaptation underlies all improvements in fitness. During exercise, your muscles undergo a stimulation by being fragmented, and during rest, these fragments are reconstructed to be more robust than before. The efficacy of the repair and reconstruction phase is largely dependent on the availability of appropriate nutritional substrates. The body's capacity to repair tissue, replenish energy stores, and effectively adapt to training diminishes when it lacks enough high-quality protein, essential micronutrients, and water. This guide aims to provide a systematic, evidence-based compilation of exercise guidelines and nutritional strategies suitable for anyone over 50. The discussion focuses on 3 interconnected domains. 1. Lower body strength and balance, foundational to mobility and autonomy. 2. Upper body strength and posture, essential for daily activities and spinal integrity. And 3. Comprehensive movement and cardiovascular fitness, beneficial for cardiac, pulmonary, and cognitive health. Each topic includes practical exercise choices and detailed recommendations for post-workout nutrition to facilitate recuperation and enhance the training stimulus. The primary objective is to provide individuals seeking to preserve or enhance their functional capacity, vitality, and overall quality of life a practical framework. The emphasis is on sustainable behaviors that facilitate the gerontological aim of compressing morbidity, defined as reducing the duration of illness or disability in later life, while also extending health span, which refers to spending a greater number of years in optimal health rather than just increasing lifespan. Lower body strength and balance, essential for independence. The muscles and joints in the hips, thighs, and calves are crucial for fundamental movements that enable independence, such as rising from a chair, ascending stairs, traversing a room, and navigating obstacles. According to prominent public health organizations, such as the World Health Organization and the U.S., falls represent a significant health hazard for the elderly. The Centers for Disease Control and Prevention states that falls are the primary cause of death and disability from injuries in the elderly population. Falls may result in severe consequences, such as fractured hips, traumatic brain injuries, and prolonged immobility. The psychological consequences, such as fear of falling, can initiate a cascade of reduced mobility. The decline in physical activity accelerates muscle atrophy and exacerbates balance issues, hence increasing the risk of falls and potentially resulting in a cycle that significantly restricts autonomy. It is essential to understand that falling is not an inevitable occurrence for all individuals as they age. Numerous intervention studies indicate that specific programs emphasizing lower body strength balance training and proprioceptive exercises may significantly reduce the risk of falls. The following workouts need little equipment and are non-impact on the joints. They can be performed securely in the majority of residences. Each exercise description provides guidance on execution, recommended sets and repetitions, and progression strategies, enabling individuals to tailor the workout to their current capabilities and advance as their strength and confidence increase. Prescribed exercises for lower body strength and balance. 1. Body weight squats or chair squats. The squat is a multifaceted functional movement analogous to the everyday actions of sitting and standing. It primarily targets the quadriceps, anterior thigh muscles, hamstrings, posterior thigh muscles, and gluteus maximus gluteal muscles, all of which are essential for ambulation stair navigation and rising from a seated position. Execution. Position your feet about shoulder width apart with your toes directed straight front or slightly outward. If you need more assistance, position a sturdy chair countertop or banister behind you. Initiate the movement by flexing at the hips and retracting them as if about to sit. Subsequently, flex your knees to descend your body while keeping your chest up and your spine in a neutral alignment. Avoid bending your back or leaning too forward with your torso. Descend until you attain a state of comfort. For many individuals, the objective is to achieve a position where the thighs are parallel to the ground. Novices may securely adjust the exercise by gently contacting a chair with their buttocks before rising again, a chair squat. To rise, exert pressure through your heels and practice inhaling and exhaling as you descend and ascend. Protocol: perform 2 to 3 sets of 10 to 12 repetitions, allowing a 60 to 90-second rest interval between sets. You may increase difficulty by doing more repetitions, reducing speed to prolong muscular tension, or using light dumbbells or household objects for resistance after mastering proper technique. Safety and cues. Ensure your knees align with your toes, avoid inward collapse, and cease the activity if you experience any abrupt pain in your knees or lower back. Consider rehearsing before a mirror or with a trusted companion to monitor your technique. 2. Elevating the heels. Calf raises. It is essential to strengthen the calf muscles, namely the gastrocnemius and soleus, since they facilitate the push-off phase of ambulation and prevent foot shuffling, hence reducing the risk of falls. Execution: position yourself next to a countertop wall or the rear of a sturdy chair for minimal support. Position your feet hip-width apart and evenly distribute your weight, then gradually elevate onto the balls of your feet while maximizing the height of your heels. To intensify muscular engagement, pause at the apex of the movement for 1 to 2 seconds, then gradually lower the heels back to the ground. 2 sets of 15 repetitions are the guidelines. To increase difficulty, do single-leg heel raises when you can maintain balance on one leg, or hold a small weight in one hand while using the other for little support. Maintain a straight posture and avoid using momentum. To enhance muscle control and increase the adaptability of your ankle joint during dynamic balance exercises, proceed with gentle movements. 3. Unipedal position. This exercise targets balance coordination and directly engages the proprioceptive and vestibular systems. These systems inherently deteriorate with age, if not maintained. Execution: position yourself behind a sturdy chair or next to a wall, gently resting one or both hands on the support to start. Shift your weight onto one leg while raising the other foot a few inches above the ground. To sustain stable eyesight, maintain an erect spine-level hips and concentrate on a point several feet ahead. Initially maintain the stance for 10 to 15 seconds. The protocol specifies 2 to 3 repetitions each leg. Progressions include hovering the hands rather than holding them to reduce support during the exercise, without any contact with the support extending the time of the hold, or closing the eyes to enhance difficulty by eliminating visual information and necessitating reliance on internal balancing mechanisms. Safety and cues: engage the gluteal and thigh muscles of the supporting leg to stabilize the hip. In the absence of adequate balance, do the task near a stable surface that you can grasp swiftly if necessary. Physiological rationale and training results. These exercises enhance protein synthesis in your muscles and increase the synergy between your muscles and brain. The substantial muscles in your thighs, hips, and calves provide strength, facilitating daily activities such as walking, rising from a seated position, and ascending stairs. Simultaneously, advancements in the neuromuscular system enable the nervous system to execute rapid minor adjustments that preserve equilibrium during ambulation and transitions between locations. These modifications enhance your gait stability, bolster your confidence during movement, and reduce your risk of falling over time. Effective nutrition for lower body recovery. The body is undergoing recovery after a lower body exercise. During exercise, the minute stresses on muscle fibers need specific nutrients for their repair. Although the concept of a brief anabolic window immediately after exercise is sometimes overstated, consuming appropriate meals within 30 to 60 minutes post-workout is an effective strategy to capitalize on an accelerated metabolism and to enhance recovery and hydration. The total daily intake remains the paramount aspect in long-term adaptation. Nevertheless, focusing on post-exercise meals or snacks may facilitate recovery and sustain energy levels for subsequent activities. Following a lower body exercise, 3 essential foods to consume are protein, essential for supplying amino acids necessary for muscle repair. Leucine, a crucial branched-chain amino acid, serves as a potent catalyst for muscle protein synthesis. As individuals age, many exhibit anabolic resistance, indicating a diminished responsiveness of their muscles to the anabolic advantages of protein. This suggests that increasing protein intake, or distributing it equally across meals, may help provide sufficient stimulation for repair. Potassium and other electrolytes. These nutrients facilitate muscular contraction, neuronal signal transmission, and fluid equilibrium. You expel them significantly via perspiration. Fluids maintaining hydration aids in circulation, regulates body temperature, and enhances cognitive clarity. Older individuals often have diminished thirst sensations, increasing their susceptibility to dehydration. Intentionally consuming fluids post-exercise may mitigate this danger. Post-workout dietary recommendations within 30 to 60 minutes. Primary recommendation: 1 cup 8 ounces of low-fat milk or a fortified nutritious beverage. This provides around 10 to 15 grams of high-quality protein along with calcium and vitamin D, which are beneficial for bone health. A medium-ripe banana is an excellent source of potassium and easily digestible carbohydrates that may aid in replenishing muscle glycogen. A glass of water or caffeine-free herbal tea to facilitate rehydration. Alternative options. Individuals with lactose intolerance may have 1 cup of soy milk, a complete protein with a hard-boiled egg. Yogurt-based option: a portion of plain Greek yogurt, inherently high in protein, combined with soft potassium-rich fruits such as papaya or cantaloupe. Considerations. Numerous individuals believe that only competitive athletes need substantial protein intake. Individuals over 50 must consume sufficient high-quality protein at each meal to combat sarcopenia, the age-related decline in skeletal muscle mass and function. They must also save their strength for daily activities such as transporting groceries and engaging with their grandkids. The objective is not to increase size, like to a bodybuilder for aesthetic purposes, but to maintain muscle mass and functional capacity that enable independent living. Enhancing upper body, strength and posture, facilitating daily accomplishments. Robust arms, shoulders, chest, and back are essential for several everyday tasks, including retrieving items from elevated shelves, opening jars and doors, carrying modest loads, and maintaining an upright posture. As individuals age, they often experience a decline in muscle mass in both the upper body and lower extremities. Inadequate strength in the posterior chain, including the upper back muscles, may lead to kyphosis, characterized by a forward hunched posture. This not only diminishes your appearance, but also impedes respiration by constricting the thoracic cavity. Fortifying the muscles that retract the scapulae and support the vertebral column improves posture, facilitates respiration by expanding the thoracic cavity, and contributes to equilibrium and overall stability. An effective upper body workout may be achieved via bodyweight exercises and inexpensive portable equipment such as resistance bands. This is conveniently accessible, making it suitable for those who exercise at home or lack simple access to gyms or specialized equipment. Prescribed exercises for upper body strength and posture improvement. 1. Wall push-ups. This exercise effectively initiates upper body strengthening, especially for those with wrist or shoulder issues or those who are beginners requiring less loading. Position yourself around an arm's length from a wall. Place your hands flat on the wall, little wider than shoulder width apart at around chest height. Maintain a straight alignment from head to heels and ensure your neck is in a neutral position. Flex your elbows and position your chest and face against the wall while inhaling. Pause briefly, then exhale and return to the initial posture. Protocol. Perform 2 to 3 sets of 10 to 12 repetitions. Emphasize moderate controlled movements, ensuring the chest and triceps engage without elevating the shoulders. Progressions. To increase the difficulty of the exercise, gradually extend the distance of your feet from the wall. Subsequently, transition to an angled push-up with your hands positioned on a stable elevated surface such as the edge of a sturdy sofa. Ultimately, as your strength and technique improve, go to knee or full push-ups. 2. Modified or conventional push-ups. As individuals gain strength, they may go from wall push-ups to modified push-ups and then to standard floor push-ups. Execution. To do a modified push-up, begin by kneeling on the floor with your hands positioned under your shoulders and your knees resting on the ground. Maintain a linear alignment from your knees to your head as much as possible. Flex your elbows to descend your chest, then return to the initial posture. To do a full push-up, assume a plank position on your hands and toes. Keep your body aligned, lower yourself gradually, and then press upward. Protocol. Perform 2 to 3 sets of 5 to 10 repetitions, contingent upon the variation and your individual capacity. It is preferable to move effectively rather than excessively. Refrain from allowing your elbows to excessively flare or descend in the center. 3. Resistance band rows. Pulling movements are essential for developing the upper back musculature, including the rhomboids trapezius and latissimus dorsi. These muscles adduct the scapulae and counteract a protracted posture. To do this, secure the midpoint of a light to medium resistance band to a robust anchor such as a closed and locked door handle at chest level. Grasp one end of the band in each hand and walk backward to generate tension. Subsequently, with your arms outstretched, retract the handles towards your torso while keeping your elbows adjacent to your body. At the end of the pull, retract your shoulder blades and then gradually return to the starting position. Protocol. 2 sets of 12 to 15 repetitions each. You may do seated rows with your legs extended, execute single arm rows to focus on one side or increase the weight as your strength improves. Frequent errors and indicators. Maintain your shoulders in a retracted and depressed position, avoid shrugging, and ensure your torso remains stable to effectively engage the pulling muscles. Avoid using momentum. Rather, inhale in a consistent manner. Nutrition for upper body rehabilitation. Post-upper body exercise. Your dietary requirements largely mirror those following a lower body workout. Sufficient protein to provide essential amino acids for recovery, carbohydrates for energy replenishment, and vital minerals to support optimal muscle and bone function. High-quality protein provides the essential amino acids required for the healing of muscle fibers in the arms, chest, and back. Complex carbohydrates. These replenish glycogen lost during exertion and provide sustained energy without causing rapid fluctuations in blood sugar levels. Magnesium and calcium are essential nutrients for muscular contraction, nerve signal transmission, and maintaining bone health, which is crucial for posture and spinal support. Examples of post-workout nutrition within 30 to 60 minutes. Primary recommendation. 1 hard-boiled egg contains around 6 grams of total protein and a significant amount of leucine. 1 slice of whole grain bread or half a cup of cooked sweet potato. These items provide complex carbohydrates that facilitate a gradual restoration of energy levels. Incorporating a few slices of avocado might enhance your intake of heart-healthy, monounsaturated fats and magnesium. Water to restore the body's fluid balance. Alternative options. Plant-based, 1 cup of unsweetened soy milk and 1 tablespoon of peanut butter over whole grain bread for a complete plant protein profile. Simple combine, a scoop of whey casein or plant-based protein powder with milk or a milk alternative and a banana for carbohydrates. The adage, use it or lose it, is particularly applicable to upper body strength. Older individuals may halt or perhaps reverse declines in upper body functionality by consistent, moderate exercise and adequate diet. The tangible benefits include more autonomy and enhanced capacity to manage the physical challenges of everyday existence. Consistent sessions of moderate resistance training stimulate muscle development, while appropriate nutritional intake at optimal times provides the necessary components for tissue repair and enhancement. Comprehensive physical activity and cardiovascular well-being. Nurturing the heart and mind. A robust heart is crucial to the aging process. A healthy heart and vascular system provide oxygen and nutrients to all bodily tissues, including the brain. Consistent aerobic exercise is among the most effective lifestyle modifications for maintaining cardiovascular health. It aids in regulating blood pressure, enhancing lipid profiles, and reducing the risk of cardiovascular disease, which remains a leading cause of mortality. Cardiovascular exercise enhances the functionality of all organ systems, hence promoting independence and strength. Comprehensive aerobic exercise significantly influences mental and emotional well-being alongside its physical advantages. During movement, the body secretes neurotransmitters and neuromodulators, such as serotonin and endorphins. These compounds may enhance your mood, reduce anxiety and stress, and improve sleep quality. For several individuals over 50 who may encounter increased stress or experience social isolation, the mood-enhancing and community benefits of group activities may be especially important. When advising older individuals on cardiovascular exercise, the emphasis should be on consistency and sustainability, rather than maximal intensity. Activities must be low impact to protect joints, while being sufficiently active to elevate heart rate and respiration. Cardiovascular exercises, beneficial for heart health. 1. Ambulating rapidly. Ambulation is among the simplest and most secure methods to get aerobic exercise. It requires no specialized equipment other from supportive footwear and may be performed in various locations. Execution: ambulate, at a pace much faster than a leisurely stroll. The talk test serves as a fundamental guideline. You should be capable of conversing in entire sentences but not singing well. Select footwear that provides support for your arches and heels to alleviate stress on your joints. Protocol: aim for 15 to 30 minutes of exercise 3 to 5 times weekly, adjusting duration and frequency according to your individual health and fitness level. Practical recommendation: to increase physical activity, consider walking more often. For instance, park at a greater distance from store entrances, engage in brief walks throughout the day, or establish a walking club with friends to combine social interaction with physical activity. 2. Rhythmic aerobics. Engaging in movement to music may enhance enjoyment and promote adherence. Rhythm-based activities may challenge cognitive function by requiring individuals to recall and synchronize movement patterns. Execution. Engaging in movement to music may range from casually playing a preferred record and gently swaying side to side, lifting your knees and swinging your arms, to participating in structured classes specifically designed for seniors such as Zumba Gold or senior-focused dance sessions. These workouts simultaneously exert stress on the cardiovascular balance and coordination systems. Protocol: engage in the activity for 10 to 20 minutes every session 2 to 3 times weekly as an element of a varied regimen or whenever you need an energy boost. Dancing enhances cardiovascular health, cognitive function, social interaction, and rhythmic coordination. 3. Stationary or outdoor cycling. Cycling serves as an effective cardiovascular workout for those with joint issues since it imposes no weight on the joints and is particularly beneficial for those suffering from knee or hip arthritis. The stationary recumbent bike provides back support and maintains stability. An upright stationary bike or outdoor cycling may provide further benefits if they are comfortable. To reduce strain, ensure your bicycle is well fitted by adjusting the seat height and handlebar position to maintain your joints in a comfortable alignment. Schedule 2 to 3 sessions each week lasting 15 to 30 minutes each. When outside, use appropriate protective equipment and choose safe low-traffic pathways. When using stationary equipment, begin with brief durations and mild resistance, gradually increasing both time and resistance. 4. Daily mobility regimens. Gentle, brief mobility exercises are not often classified as cardiovascular workouts, yet they enhance circulation, joint flexibility, and general movement quality, facilitating the performance of more strenuous tasks. Execution. A brief practice lasting 5 to 10 minutes may include shoulder rolls, arm circles, gentle spinal twists, hip circles, ankle mobility exercises, and diaphragmatic breathing. Protocol: perform this daily, including recovery days, to prevent muscle tightness and maintain readiness for planned activities. Post-cardiovascular nutrition. For recovery, post-aerobic exercise, the body requires rehydration, energy, replenishment, and nutrients that enhance cardiac function and mitigate inflammation. The post-cardio diet plan must include a moderate quantity of protein, emphasize complex carbohydrates for sustained replenishment, include fluids and electrolytes, and feature anti-inflammatory foods, such as omega-3 fatty acids and those rich in antioxidants. Priorities regarding sustenance, fluids, and electrolytes to replenish losses incurred via perspiration and maintain cardiac function. Complex carbohydrates. To gradually replenish muscle glycogen while minimizing fluctuations in blood glucose levels. Moderate protein intake to assist in the maintenance and reconstruction of muscles throughout the body. Nutrients that combat inflammation, omega-3 fatty acids, and dietary antioxidants that promote vascular health and reduce systemic inflammation. Instances of post-cardio nutrition within 30-60 minutes. Primary recommendation: 1 cup of coconut water, a natural source of electrolytes, particularly potassium. A small banana or several slices of mango may provide potassium and quick natural carbs to replenish your energy. A small bowl of plain yogurt or a soy-based substitute. These include protein and, in some instances, live cultures beneficial for gastrointestinal health. Optional: incorporate chia seeds or ground flaxseed into the yogurt to enhance fiber and plant-based omega-3 content. Palatable alternative: 1 tiny cooked sweet potato. It contains complex carbohydrates and potassium. Protein may be obtained by consuming grilled tofu or a poached egg. A warm cup of water or herbal tea with lemon is beneficial for rehydration and gentle on the stomach. Dietary patterns rich in B vitamins, magnesium, and omega-3 fatty acids may enhance the long-term advantages of regular cardiovascular exercise on mood, cognition, and sleep. These nutrients facilitate optimal brain function, maintain emotional stability, and promote cardiovascular and metabolic health. Integrating it. Practical application and weekly planning. A sustainable program for those over 50 includes resistance training for both the upper and lower body cardiovascular activities and a focus on nutrition and recovery after each session. The quantity, frequency, and intensity should be adjusted according on each individual's initial fitness level, medical history, and personal goals. The following structure illustrates how the aforementioned activities and nutritional recommendations might be integrated into a practical weekly routine. This example is not intended for universal application. Rather, it illustrates the distribution of activity and relaxation across a typical week. Illustration of a weekly structure methodology for organization. Day 1. Engage in lower body strength exercise squats, heel lifts, and single leg stance, followed by a post-workout snack for the lower body, milk or soy milk with a banana. Allocate a sufficient time for relaxation thereafter, and ensure enough hydration. Day 2. Engage in a brisk walk or light cycling for 20 to 30 minutes thereafter, consuming a post-workout snack of coconut water and yogurt with chia seeds. Day 3. Engage in upper body strength training, progressing from wall push-ups to modified push-ups and including resistance band rows, followed by a post-workout meal for the upper body, a hard-boiled egg accompanied by whole grain bread or sweet potato. Day 4. A brief mobility regimen including gentle balancing exercises and optional light dancing or rhythmic movement for a duration of 10 to 20 minutes. Should you like, you may designate this day for active recuperation, ensuring enough hydration and consuming a balanced snack. Day 5. The workout regimen consists of a brief lower body circuit followed by a concise upper body session. Subsequently, one should have a balanced snack including both protein and carbohydrates. Day 6. Engage in an extended low-impact cardiovascular exercise such as walking or cycling for 25 to 30 minutes, thereafter hydrate with water and have a small snack containing carbohydrates and protein. Day 7. Rest or engage in gentle mobility exercises, focusing on respiration, flexibility, and light movement to facilitate recovery, adaptation, and progression. Progress should be made gradually and meticulously. Several significant strategies for progress include augmenting the number of sets or repetitions within permissible constraints, reducing the pace of an action to provide the muscle more time to engage, incrementally reducing external assistance to assess balance, incorporating a little amount of resistance such as light dumbbells or household items while maintaining impeccable technique, incrementally increasing aerobic workout duration by 5 to 10 minutes every few weeks as endurance improves. Safety and individuality are paramount. No exercise regimen or dietary plan should be universally applied without considering individual medical requirements. Individuals with heart disease, diabetes, osteoporosis, or uncontrolled hypertension should see a trained healthcare professional, such as a primary care physician, physical therapist, or registered dietitian, prior to initiating a new exercise regimen or implementing significant dietary modifications. Professionals may help tailor the strategy to accommodate medications' joint issues, cardiovascular concerns, or dietary limitations. Furthermore, it is essential to use prudent measures to ensure safety while exercise. For instance, don footwear that provides enough support, ensure the environment is safe and devoid of tripping risks, and maintain a reliable means of communication if exercising alone. Conclusion: an approach to healthy aging that is both all-encompassing and sustainable. Individuals over the age of 50 have the potential to improve their health by combining conscious eating with regular, focused exercise habits. Individuals have the ability to significantly improve their health by consistently adhering to the recommendations contained in this guide. These recommendations include strengthening the lower body and improving balance in order to reduce the risk of falling, strengthening the upper body and improving posture in order to make daily activities easier, and engaging in full body movement in order to improve cardiovascular and cognitive health. The body undergoes physiological changes as a result of exercise, and post-exercise nutrition supplies the body with the vital nutrients it needs for recuperation, repair, and increased resilience. It is not necessary for a successful long-term wellness plan to be flawless or to aim for the highest possible level of physical condition. Consistent physical activity, careful post-workout nutrition, and gradual individualized training that is in touch with the signals sent by the body are the foundations of this approach. Included among the key ideas are physical exercise. Make it a goal to participate in some kind of physical exercise on the better part of each week. Even little periods of deliberate physical activity, such as 10 minutes of concentrated effort, may have a positive impact on one's health. In order to facilitate recovery, it is not required to consume an excessive amount of food after exercise. Recuperation may be considerably improved, and the advantages of exercise can be amplified by consuming a moderate breakfast or snack that is well proportioned and contains protein, nutritious carbs, and water. Research serves as the foundation for the acts and rules that are provided here, which pertain to personalization. It is imperative that individuals pay attention to their bodies, slow down when required, and make moderate progress. Before beginning a new exercise or nutrition regimen, it is strongly recommended that you get the advice of a medical professional, particularly if you are dealing with a chronic medical condition. There is no need that aging indicate a continuous reduction in conditions. By taking a proactive and educated attitude to exercise and diet, individuals over the age of 50 have the potential to greatly impact the acceleration of their aging process. Each instance of participating in mild strengthening, taking a brief walk, or enjoying a healthy snack post-activity becomes a purposeful choice to boost your future strength, health, and liberty. It is common for people to discover that as they become older, they are able to participate in their interests more successfully and with more clarity if they practice patience, remain consistent, and concentrate on both physical activity and recuperation eating techniques. Thank you for watching the video. Please let us know your thoughts and goodbye for now.